Welcome back to another episode of the examination series, and today with Rick Anglis we're going to be talking about how you prepare for the exam and some tips in your preparation. What do you recommend people do over what proportion of time do you recommend trainees prepare for the exam?
Time, it depends a little bit on how you study, but as a broad answer, I'd say 12 months of just studying curriculum and getting through all of the aspects of orthopaedics that you could possibly be examined in. Really concentrating on first principles as part of that, having a structure. So 12 months of developing a structure, that might be a pathophysiological sieve, it might be a way of answering surgical questions, approaches, that sort of thing. But having a structure around which to base your study. And as part of that, my personal opinion is that your study group is key. If you've got a really supportive study group that is will challenge you, will call you out when you get things wrong, and really keeps you honest, to me that's the best preparation. So 12 months of curriculum and just the hard slog. And then, so let's say you start in January of the year before you want to sit, and you're going to sit in May, then you do 5 months of the performance art. How do you phrase questions? What does a particular term mean in the context of your answer? How do you turn fact into higher order reasoned rational discussion? All of those sorts of things are very important. So the performance in the exam is seen as being showing confidence that you can be a first year consultant surgeon, working largely independently but with good backup if you need it. And that's really the standard of the exam. People call it the Wagga principle. So you're doing a locum in Wagga day one of being a consultant. And are you going to be safe, effective? Are we putting you at risk by putting you out there? Are we putting the community at risk by putting you out there?
In terms of preparing for the exam and resources you might use, one of the things I certainly heard, I'm not sure if this is true, but that's a lot of the questions, for the example, for the multi-choice are based on papers such as the Academy of American Orthopaedic Surgery questions, or British Journal of Surgery, with recent papers. People say 5 years. Is that a relevant thing to study? Is it true that questions come from there, or is that just a good thing to get your head around to prepare?
No, all of the examiners will be preparing and submitting multi-choice questions from those sources. So the last 5 years of literature, nothing too esoteric. The Journal of Left Toe Surgery probably won't get a Guernsey, but the current concepts, literature reviews, hallmark papers that people are talking about. For example, you might be looking at Journal of Pediatric Orthopaedics or Journal of Shoulder Surgery, if there is such a thing. But the article is taken as a reasonable article, read by usually somebody who knows what they're talking about in that field. So the shoulder surgeons will generally produce MCQs on shoulder surgery. The paediatricians will do MCQs on paediatric surgery. There'll be questions on ethics. There'll be questions on basic science all through the MCQ. But that component really is about current concept, broad knowledge of the literature, and there's no substitute for just reading the literature.
Easier said than done.
And then discussing it with your study group.
Yep. Which will hold you accountable to doing the work as well.
One way to do that is to say, read the paper, and then in the study group, so what did you get out of this paper? What were the 5 most important things you got out of this paper? Because the examiner's probably going to get 4 of those 5 things out of it, and that's where the questions will come from.
Okay. And anything else worth using in terms of study preparation? Any other resources or things to do in your study time in the preparation phase?
Seeing patients, seeing clinical scenarios, and being able to relate a particular patient back to a set of questions. The one thing you don't want to really be doing in the exam is speaking in generalities when you're being asked about a specific patient, because it is meant to be a discussion of higher order thinking about the management of this person in front of you.
Okay. Well, that's a good summary of things to do before the exam, and I guess a rough timeline of the lead up, where you said mainly about a year or so of curriculum study, which is based on the AOA training curriculum, and then dedicating a good amount of time to the performance art, so revising, being able to, I guess, express your knowledge of that understanding, and then go to the next level in higher order thinking and using those facts to establish answers to questions, working through cases, talking to colleagues about clinical scenarios.
Yeah, and you might notice I haven't linked in, and I don't believe you should ever try and link in your progress through the modules and the other requirements of AOA 21. You know, there's no point studying 5 or 6 or 7 modules in depth and forgetting the others, because the others will be examined in the exam. So the progress through the other components of your training are things that you're going to have to do anyway. Study for the exam is in a different way.
Yep.
It's covering the whole aspects and generalities.
Yeah, so it's not like the
getting
modules that are prerequisites for the exam are the only ones that are assessed.
Correct.
It's going to be the whole
Yeah.
lot, so you need to have quite a breadth of reading in your preparation.
Yeah.